inspections and fines for allegedly problematic Houston apartments has been delayed due to industry pushback. We'll discuss this and more of today's top stories. I'm Ernie Manouse.
And I'm Celestia Sherman. We'll also be joined by Amanda Seitz, a health reporter with KFF, who will discuss the uncertainty currently surrounding the Affordable Health Care Act.
Plus, Sean Tajipour from Nerdtropolis will be here to give us his movie recommendations for Halloween, and we want to know yours.
So give us a call or send us a text at 713-440-8870 or email us at talk@hellohouston.org. You can also watch us on YouTube by going to houstonpublicmedia.org.
All that and more right here on Hello Houston after the news from NPR and News 88.7.
Hello Houston is made possible in part by founding sponsors John Bradshaw and Kathy Sanders, and by gifts from listeners like you.
Live from NPR News, I'm Lakshmi Singh. President Trump says the U.S. will start testing nuclear weapons on an equal basis with Russia and China. NPR's Jeff Brumfield reports the announcement could mark a reversal of decades of policy.
The president made his announcement in a lengthy post on Truth Social. The U.S. has not conducted a test of a nuclear weapon since 1992. Instead, it uses scientific experiments and computer simulations to make sure its bombs still work. The voluntary test moratorium has been in place since the end of the Cold War as part of an effort to maintain nuclear stability. It's not entirely clear what resuming testing on an equal basis means. The U.S. is not prepared to conduct a nuclear test in the near term, and China and Russia haven't tested their nuclear weapons in decades either, though both nations have been modernizing their arsenals in recent years. Jeff Brumfield, NPR News.
NPR has obtained the draft text of a proposed rule barring federal Medicaid reimbursement for medical care provided to transgender patients younger than 18. The proposals by the Department of Health and Human Services also would prohibit reimbursement through the Children's Health Insurance Program, or CHIP, for people under 19. And additional proposed rule would go further, blocking all Medicaid and Medicare funding for any services at hospitals that provide pediatric gender-affirming care. There's been no formal HHS response yet to this. With no apparent end to the government shutdown in sight, more than 65,000 infants, toddlers, and preschoolers are at risk of losing access to Head Start, the federal program that provides childcare and early learning for low-income families. Here's NPR's Corey Turner.
Head Start programs all over the country are on different federal funding cycles, and the National Head Start Association says 134 of these programs are supposed to get their next round of funding November 1st, but they can't if the government is shut down. These at-risk programs are in more than 40 states, but the hardest hit will likely be in Florida, Georgia, Missouri, and Ohio. Overall, Head Start serves about 750,000 children, providing high-quality preschool, health screening, and free meals. If the shutdown continues, more and more centers will run out of money each month. That'd force many working families to choose between taking care of their kids and going to work. Corey Turner, NPR News.
Universal Music Group says it has reached a settlement with artificial intelligence music platform Udio in a copyright infringement lawsuit. And UMG says the two are collaborating. They're launching a subscription-based AI music creation, consumption, and streaming platform next year. UMG is also joining forces with Stability AI to work with artists in creating licensed tools. UMG, Sony Music Entertainment, and Warner Records are still suing the developer of Suno AI. This is NPR News.
Live from News 88.7 in Houston, I'm Tom Perumian. Firefighters battled a large blaze at an abandoned apartment complex in northwest Harris County this morning. It's the second time this month that the Front Royal Apartments have caught fire. KHOU reports multiple collapses in the building that has been abandoned for decades. And the property has been slated for demolition. However, multiple fires continue to break out. No injuries have been reported. The U.S. Coast Guard is continuing to monitor the after effects of an oil discharge that occurred near Galveston earlier this week. The Coast Guard received reports that it was the result of a vessel colliding with a pier. President Trump says China will resume purchase of soybeans made in the United States as the two sides hammer out a trade deal. Houston Public Media's Rob Salinas says the deal would be a welcome relief for Texas farmers.
Texas is not one of the big soybean producers in the country, but it is still facing the same problems. With the Chinese market cut off, farmers have turned to Mexico to unload their product with limited success.
Congestion in Mexico, rail congestions, pricing. It has not been successful shipping beans into Mexico thus far this year.
Brett Mock owns the Victoria Calhoun Grain Company in Placidio. He says the soybean harvest in the United States was strong this year, but with no export market, they're just piling up.
They're sitting in my storage tanks.
Texas farmers are facing economic strain because of rising production costs and low commodity prices. The Trump administration has hinted at a bailout while trade negotiations continue. I'm Rob Salinas, News 88.7.
Checking your weather. It's going to be sunny and nice today, 71, with breezy winds up to 10 miles an hour. Right now, it's mostly clear, 58 degrees on the UH campus. And get more information. Go to HoustonPublicMedia.org. I'm Tom Perumian, News 88.7.
Support for NPR comes from NPR stations. Other contributors include Charles Schwab, offering investors choices like full-service wealth management, advice, investing, and trading on Thinkorswim. Learn more at schwab.com. And from the Doris Duke Foundation.
Live from the University of Houston, it's Hello Houston, an open forum on today's biggest stories affecting Houston and beyond. Call now, 713-440-8870, or let us know your thoughts on today's topics by emailing us at talk@hellohouston.org. Now here's your host for Hello Houston, Ernie Manouse, Celeste Diaz-Sherman, and Frank Billingsley.
Mostly accurate.
Mostly accurate.
Celeste and Ernie are here. Frank, not so much, but he'll be back with us shortly.
Yes, he will be back shortly.
You know, it's Halloween. He's got to crawl back into his crypt until tomorrow night, and then he emerges again for another year.
We miss Frank, and we will look forward to when he is back next week. But, you know, I always love to jump on YouTube and look at the definitely feeling eerie about Halloween this year. Ooh.
I love Halloween. Well, we all know that. You know, today, though, has been a very difficult day for me.
Uh-oh. Talk to me about it.
Because I want nothing more than a donut, and I have searched this building over for a good donut, and I have not found a donut, and I don't know. I said to Jim, our EP, before the show, do I have time to run to a store and get some donuts? He's like, no, you've got a show to do. I'm like, yeah, but I need a donut. Well, so I'm doing the Sans donut today.
The donut, well, you know, it's funny because I was looking for you to do pre-record our billboard, and I said, where is Ernie? I haven't seen him. And they said, well, he's around looking for a donut. And you know, last week, I brought Philip, my 4-year-old son, to work with me, and he was in my office. The next day I know he wasn't. I said, I'm sorry, where does anybody know, has anybody seen Philip? And they said, he's running around looking for a donut.
See, you can't escape us children.
He found a donut.
But you know, that leads me to a question. If you're listening, right, who makes your favorite donuts? Is there a donut shop or donut that you just love? I know this isn't on our script for today, but I'm just curious. I'm still on my search for a great donut. So if you want to call and share with us what you think, why don't you give us a call? 713-440-8870. What donuts rock your world? Ooh. I'm really bad. I tend to go to the grocery store and I buy always the manager special donuts.
Oh, no.
Like it's the next day and they're like 16 donuts for $3. Those are the donuts I buy, but definitely looking for something better than that.
Oh my gosh, that is so funny, Ernie. No, I like it right off batch, fresh, warm. Right
on the flip side, and I shouldn't give brand names, but a Shipley's donut fresh out of the oil, when you can go by there and pick it up when it's still warm,
delicious.
It's like a cloud in your mouth.
Melts in your mouth. It's delicious.
Also, coffee. We love our coffee here. I did notice I've been stealing Celeste's creamer, and on the creamer it says, naturally sweetened with cane sugar. I don't consider that naturally sweetened. I consider that added sugar to your creamer.
Well, I find it very sweet, Ernie, that when I walked in to start the show, you said, Celeste, do you always just use alternative milks or do you like dairy? And I said, well, you know, whatever. I like it to just be sweet. And you said, okay, good, because I've been stealing your creamer. And
Yes. We have some folks commenting. Parlor Donuts is a pretty good one. This is over on our YouTube. If you're not following us on YouTube, you're missing half the show.
Very croissanty.
Well, I like that.
Me too.
Gads in Bowling Green, Kentucky.
They do a strawberry cake. That sounds delicious.
But a little distant for me to get to today.
Oh, look at this. Mochi Donuts at T. Amore in Deer Park.
We actually have a phone. I know this is probably driving Jim crazy that we're not getting into the show, but let's grab Rachel from Richmond right now. Rachel, what's on your mind?
Good morning. My absolute favorite place to get donuts is West Coast Donuts on the intersection of 359 in Richmond, Texas. I'm from California, never ate donuts, moved to Texas, absolutely love this place. She makes them from scratch at 5 a.m. every morning. She's an immigrant and she's amazing.
Wow. So what do they taste like? Now it's going to go to food
like
porn
heaven
here.
in your mouth.
Yeah.
It's very similar to like a Krispy Kreme donut, not heavily starched, so more light and airy, super warm, perfect, literally perfect, way better than Shippers.
All right.
Rachel.
Thank you, Rachel,
Thank
for
you.
that tip. The number here, 713-440-8870. You know what? I really should have saved this to Current Obsessions part of the show. So I'm going to grab Stanley here. But then if you want to start sending them in when we get to Current Obsessions a little later in the show, share them with us then. Does that sound? That'll calm our production staff who's like, Ernie's gone rogue. Let's get Stanley from West Chase. Stanley, what's on your mind?
Hello.
Hello, Stanley.
I'm 60 years old, so I don't eat a lot of donuts now. But when my cycling club does a ride from Katy to Belleville, I always feel I'm okay to have a fritter from Newman's Bakery in Belleville. The fritters there are fried. They're a fried kind of blob of donut batter and dipped into sugar and coated with sugar. Blueberry fritter, apple fritter. If you're riding 25 miles on your bicycle to get there and 25 miles back, it's okay to have a fritter.
I agree with you there,
agree.
Stanley. And I'm also very sad because you people are not helping me get over my donut craze right now. This sounds delicious.
I've got to say, Stanley, my father-in-law is a cyclist, and he often does that route. And we've actually eaten at Newman's Bakery out in Bellevue. It's absolutely fabulous. I think that if you're in Houston or the Houston area and you're looking for just a day trip out, Belleville is amazing.
All right, I said I would wrap this up right now. We'll come back to it, so don't worry. Keep sending them in. We'll gather them up. We'll share them later
we're
in the
getting
show.
quite a few comments
Tiffany
right here.
just said HEB glazed sour cream donut holes. See, I don't have a problem with grocery store donuts. I mean, I do understand you can get the fancier ones, you can get really clever ones, but sometimes just a good old-fashioned glazed donut, or in this case, a sour cream donut hole. Okay, there's enough on donuts for now. But coming up, in case you didn't put it together, we're going to be doing Current Obsessions in the second hour, where we want to know what your obsessions are. Mine has quickly become donuts today. But anyway, give us a call. Yeah, somebody said, I think you've had the conversation about the Shipley's Donuts before on the show. We have talked about Shipley's, but we'll get back to it. So that's coming up later in the show. Beautiful weather out there. It's feeling nice and cool.
It is
very crisp. I love it. I can't wait to see the kids in Halloween costumes tomorrow night.
Yes, it's going to be great.
All right. That being said, we also have things on the show. We're going to be talking about the ACA, the Affordable Health Care Act, to see exactly what it means to you and your family with what's been going on, both in Washington and politically, I should say. Also, we're going to put together a list of our favorite horror films for Halloween that you may be able to watch, be it with your families or alone if you want to get scared. Ooh. And Dr. Peter Hotez, an episode of InnerVIEWS, is coming up, a sample of that later in the show. But all that said, Celeste, take us into the headlines.
Yes. After 4 years of development, a proposed ordinance to ramp up inspections and fines of allegedly problematic apartment complexes was delayed Wednesday by Houston City Council member Letitia Plummer, the author of the law, who in an interview pointed to pressure from an industry association. The proposed ordinance is intended to protect residents from substandard and dangerous housing conditions through more stringent enforcement and required registration. If approved, it would create a new registry of high-risk rental buildings based on the volume of 311 complaints and basically housing-related citations. Buildings in the registry would be subject to additional inspections and daily fines for persistent violations of health and safety standards. The Houston Apartment Association sent a letter to Mayor John Whitmire and the City Council on Monday, arguing the proposed process to identify so-called high-risk rental buildings is flawed. Plummer said she will continue to advocate for the ordinance as proposed before the scheduled vote next week. On Tuesday, several community members spoke in favor of Plummer's intention, while arguing the revised ordinance didn't go far enough. What do you think about the proposed apartment inspection program? Now is the time to join us. You can give us a call or send us a text, 713-440-8870.
You know, on the surface, I think it's very important, and I think it's a good idea. A problem that I have, and it may sound rather crass, but I think it's something we do have to pay attention to. A lot of people live in substandard apartments because they cannot afford anything else. And if, in fact, this kind of policy goes through without support for people who cannot afford a place to live or do not have alternate opportunities available to them, what happens? You know, if you put a heavier price tag on these, what we called back in the day, slumlords, or people who do not keep up an apartment, to do it, they will then raise the rent to do that, and then these people are forced out. Not that people should be living in substandard situations. I'm not advocating for that, but I'm saying we as a society had better be ready to help the people who cannot afford if prices go up on that. There's got to be some idea, and I haven't read the proposal fully, but that it does not increase the tenant's responsibilities in rent, that there's got to be some kind of stabilization there as you improve. And people should not live substandard.
I think that there's a couple of things at play here. Number one, I want to just applaud Letitia Plummer for actually going out there and saying this is an issue. She is going to be going up against, larger apartment complexes, organization. We understand that a lot of these developers sometimes have deep pockets and they might have multiple level different price points of complexes, right? But the question becomes, what is the standard when we look at a basic bottom line? And she has a checklist, an apartment checklist, where it talks about the landlord responsibility and the tenant's responsibility and fair housing for tenants. And one of the things that is where you can keep landlords accountable is through health and safety risks and what is deemed the state at a state level. The state of Texas thinks this is causing a health and safety risk. And when I read it, I was like, well, this is common sense. Right. Sewage backups, faulty wiring, roaches, roof leaks, rats, lack of heat or air conditioning. That's the standard that a tenant or a landlord has a responsibility to provide without raising rent. Right. And so then you ask yourself, okay, well, what type of calls to action can a tenant have to hold their landlord accountable? Well, first they have to notice the landlord, give notice to the landlord. Then they have to make sure that their rent has always been paid on time. They have to give the landlord reasonable time to make repairs. Then they can call 311. Then they have to provide a second notice, and all of these check marks or these things that they have benchmarks that they have to do, all require time for the landlord. So during that time, these people essentially are living with sewage backups, faulty wiring, roof leaks, roaches, rats, lack of heat or air conditioning. And I just feel like this, when I look at this checklist, a lot of these notices have to be notarized with an official notary. That costs money. They have to be, looked over by a second party. That costs money. Who's going to pay for transportation for them to get there? It just doesn't quite seem fair to me. And now there is a list of resources out there like, Lone Star Legal Aid. Well, given where we are at right now, are these resources still in effect? Houston Volunteer Lawyers, South Texas College of Law, Houston. It takes time for these things. And so I guess my point to all of this is that there has to be more accountability on the landlords in regards to the base standard level, and not just accountability as in like, oh, you have to do all these things, but a timeline. Hey, if you've been notified, you have 3 weeks to get back to this person.
Mm-hmm.
I just think it's not fair that people have to live in these conditions. And the question then becomes, well, if they are actually being provided a basic standard of living, that automatically the cost goes up. Right. I have issue with that.
Yeah, I absolutely agree with everything you've said. What I'm saying is the concept and the reality of the situation often are different. And that we absolutely, you have to have a base minimum of what is considered a livable environment for someone when it comes to rental.
Right.
And that should include all of the things you said, especially in this area. You know, you've got to have air conditioning. You've got to have heat.
Have to have air conditioning, heat.
Even though at my house, I never turn either on. So they're coming after me. But
your mom.
The problem is, in reality, we've got to make sure we're also building in a safety net for people who are going to get pushed out of where they're living, places that some landlords are going to say it's not worth fixing it up, we'll just shut it down.
See, that's
so
where I
where
think
do those people
what we're talking about, though, is we're already talking about those people, Ernie. That's the way I see it, is that these are people that have been pushed out of places that just this is the minimum standard. Right. And now they are almost in these substandard places, and these substandard landlords still get to play by the same rules that everybody else gets to play by, but their tenants don't get to play by those same rules.
Right. But what happens now? So now you've got substandard landlords. This passes through, and then it's like, I can't afford to fix that up. I'm shutting that house down. Okay, now there's 20 families in that complex. Where do they go? I'm talking about as we develop this solid, simple, easily agreed upon minimum level of what should be considered a livable environment, we have to keep our eye open on how do we work with displaced people during it? Because already we're watching a situation where we have homelessness in the city already.
Right.
So both have to work together. The whole thing has to work. But absolutely, I agree with you. We need
to get a hold of this because, when we think of families, and there are children that live in these, type situations. There are people that don't want to necessarily not be able to afford their rent or be in these situations. Yeah. A lot of times these landlords go unchecked because when you look at everything you have to do in order to get any type of accountability for them.
Well, it's just basically like a restaurant. There are certain guidelines you have to meet to be able to provide food to the public, and they have inspectors that go around and look for that. It doesn't seem out of place to have the exact same thing when it comes to housing. And some restaurants aren't going to be able to afford it, and they're going to close. Those customers will be able to go to other restaurants. But when it comes to housing at that low income level, that's where it gets tricky because we don't provide for that. Yet we're putting up, and not to say we should keep them in the substandard. I'm not saying that at all. We had Nikki comment online, are there any mentions of mold? I feel like a lot of housing here has mold problems because of the humidity. Mold is a tricky one.
Yeah, mold is a tricky one.
Especially
because
in this area.
To be evaluated.
Yeah.
I didn't see anything on mold, and I looked over this pretty extensively, but it's interesting for sure.
Nikki also comments, it seems like some people view being a landlord as a side hustle and aren't prepared to take on the real responsibility it is.
Totally.
You're creating an environment for someone to live in. They should have a livable space.
For sure.
Pure and simple. So I applaud the movement by City Hall to make something.
Councilmember Letitia Plummer.
To make something better for the people in this community. I also am concerned, though, let's not shove people out into the streets, and let's make sure in this breath, we also talk about giving them affordable housing throughout the whole city. Before we run out of time in this segment, a couple days we got to look at. Today is National Wicked Day.
Ooh.
I guess in anticipation of the movie coming out. That seems a bit commercially.
I was thinking Halloween.
Yeah, but it's Wicked, all capital letters, so I think that's what they're doing. Today is National Treat Your Pet Day. So treat your pet well today.
My kids are going to get a lot of treats.
Are they? Well, good.
They're not my pets, but still.
It's National Candy Corn Day. Where do you fall on candy corn?
Love candy corn.
Do you love candy corn?
I do. You don't like it, do you?
Believe it or not, I'm going to say this, and it's going to come back to haunt me. I find it a little too sweet.
Oh my gosh, Ernie Manouse.
You found
Put
the
it with
thing.
Spanish peanuts, salted Spanish peanuts, and candy corn.
Oh,
delicious.
A new tip for Halloween. Remember, early voting is still going on. I want to make sure you get out there and vote. You have today and tomorrow, 7 a.m. to 7 p.m. both days. You can take Metro for free to and from polling places if that's standing in your way. If for some reason you cannot get over there for that, remember, Election Day is Tuesday, November 4th. Again, 7 a.m. to 7 p.m. If you're registered in Harris County, you can vote anywhere in Harris County. Same thing with any county you're registered in, as long as you're within that county. But make sure you vote.
And we will have special programming during voting as well.
Yes, actually, funny you should remind me of that. November 4th at 8 p.m. We're going to be on live with a live election update as the evening progresses to talk about the issues and what we know about the races as we know it. So join us election night at 8 p.m. right here on News 88.7.
Coming up on Hello Houston, we'll speak with Amanda Seitz, health reporter with KFF, about the uncertainty currently surrounding the Affordable Health Care Act. This is News 88.7. Stay with us.
Want to binge All Creatures Great and Small, catch up on Nova, or revisit Ken Burns' documentaries? You can with PBS Passport. With a gift of $5 or more per month to Houston Public Media, you'll get access to PBS Passport that lets you watch your favorite programs anytime you want. Support the programs you love and enjoy them on your own schedule with PBS Passport. Make your gift now at houstonpublicmedia.org/donate.
Gothic literature says about being human.
I think it makes us understand the darker sides of humanity.
Look at the meaning behind Mexico's Day of the Dead festivities.
Dia de Muertos is not Mexican Halloween at all.
And take a ghost walk to the spookier side of New Orleans.
Humans like a good chill down their spine. They like a good scare.
On the next Travel with Rick Steves.
Tune in Saturday at 6 a.m. on News 88.7.
After a Marine is killed during the Iraq War, his squad turns their guns on civilians.
I remember I opened a Humvee and I just see bodies stacked up, and I open another one, the same thing.
Marines are charged, there's a trial, but in the end,
it's meaningless. The government decided not to hold anybody accountable.
Military injustice on the next Reveal.
Saturday afternoon at 2 on News 88.7.
Support comes from Berkman International, providing insights into workplace dynamics and individual needs to help organizations develop talent, improve communication, strengthen retention, and drive innovation. More at berkman.com/connect.
Support comes from J.P. Morgan Chase, committed to investing in the people of Texas and supporting access to resources that help foster community and economic growth. More at jpmorganchase.com/communities/Texas.
And now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. Now here's Ernie Manouse and Celeste Diaz-Sherman.
We were just talking about the movement to make sure that landlords provide at least an adequate level of living for people when they rent. We had a comment from Dark One over on YouTube who said, one big mistake renters make is withholding rent when the leaser fails to maintain. This only gives the leaser the option to evict. An extremely good point, and that's why we wanted to go back to that.
Yes.
It's important for people to understand. As long as you're paying your rent, then you can fight legally against what's happening. If you're not, then you can fall into the issue there. Anyway, on with the show.
Open enrollment for the Affordable Care Act marketplace begins next month. But for millions of Texans, there's growing uncertainty about what their coverage will actually cost. Enhanced federal tax credits that have helped lower premiums are set to expire at the end of the year, and Congress remains deadlocked on whether to extend them. Advocates say that confusion could leave many people without coverage or with surprise bills they didn't expect. To help us make sense of what's happening and what it could mean for families right here in Texas, we're joined by Amanda Seitz, a health reporter with KFF, a nonprofit organization focused on health policy research, polling, and journalism. Amanda, welcome to Hello Houston.
Thank you so much for having me.
And if you would like to join the conversation, if you have a question, you can give us a call or send us a text at 713-440-8870. Now, Amanda, we understand at this point both Republicans and Democrats have dug their heels in. Republicans are saying Senate Democrats must vote to reopen the government before they're willing to negotiate on anything Affordable Care Act on costs. That does not seem that unreasonable to me. Talk to me about what is at stake.
Yeah, well, certainly the cost of health insurance for millions of Americans is at stake here. 24 million Americans who rely on the marketplace coverage. It's gone up exponentially because of these subsidies that Democrats approved during the COVID era. A lot of people joined the marketplace because the coverage was simply cheaper for them. So I like to put it this way. Think of it like you're going to the grocery store. You're going to buy milk and eggs, and you have $5, and you have a really good coupon. You get to the grocery store, you see that the price of the milk and eggs has gone up, and then you get to the checkout and you find out that the store is no longer honoring your coupon. So now you have a really tough decision to make. Am I going to find another way to pay for these milk and eggs? Or do I just need to skip the milk and eggs for this week? That's kind of the reality that these 24 million Americans who can start enrolling in Obamacare coverage on Saturday, that's what they're going to be facing. The insurers have not only raised the cost of the health insurance plans dramatically this year, but those subsidies, those coupons, the discount that was offered during the COVID era is expiring as well.
Take me back, though, a little bit to help understand this. I know you said premiums are going up, the costs are rising. Had we not had the COVID shutdown and we hadn't gotten these subsidies approved
in 2021,
where would we be today? Would we be in the same place? But we wouldn't have had this relief for these number of years in between, or am I reading this wrong?
Yeah, I think that's kind of a point that Republicans have made. Listen, these subsidies were meant to be temporary. They were kind of covering the rising cost of health insurance plans. I would point out, though, that insurers in part are dramatically increasing the price of these plans because these subsidies are expiring. And they're saying that they need to raise the price because you're going to see so many people fall off of the marketplace. And a lot of those people are going to be your healthier, younger people who think that they can go without insurance. So insurers are saying we're going to be left with a sicker, older pool to cover and less money. So that's part of why you're seeing those dramatic increases in the actual plan price this year in particular.
But if they hadn't had the subsidies that came in during COVID, at this point, would we still have seen the prices go up? Or do you believe they're taking advantage of the situation? And advantage is probably taking advantage is probably a harsh way to put it, but opportunity.
Well, insurers have certainly said that it's not just the subsidies that are causing them to raise these prices. It's other factors too, as the rising cost of medical care. We actually saw people utilize medical care a little bit less during the COVID years, but now insurers have said they've seen a significant rebound. So there are a number of factors at play here.
Right. And so, I've got to ask you, Amanda, pressure is obviously mounting for Democrats to come to the table. Well, we understand they're largely signaling that that's not going to happen. If Congress does manage to strike a deal, how significant would the changes be to the marketplace?
That's a great question. So there's a couple options on the table here. Congress could not strike a deal, obviously.
Yep.
It could extend the subsidies as is. That's something that you're seeing a lot of insurers push for because they're like, there's a ticking clock here.
Right.
And that would be the easiest way to update the marketplace to reflect these prices. But Republicans, too, have said that they want a few things. If they do even agree to extend these subsidies, they want to look at the income caps that have been put in place that ensure that people only pay a small percentage of their income on health insurance plans, for example. That's something that's been floated. There's also been some other contingencies brought up, too, that they might consider as well.
Let me quickly ask here. So and I don't want to get overtly political, but I don't know how you can talk about this topic these days without it being political. From a strategy point of view, the Democrats standing up and saying, we don't want these subsidies to expire, therefore we're not going to sign on to the continuing resolution. Had they gone ahead with the continuing resolution and let things play out as they were going to, we still would have been hitting this point where all of a sudden subsidies were going to go way up high. They still, because the continuing resolution was only for a period of time, there would have been, I think, a community outcry saying, oh my, look what just happened. And then the Democrats could then challenge when the CR ran out, and they would have had people having seen what happened on their side. And if this program that I'm talking about would have worked that way, why did they not choose to go that way? Why shut down now and let this happen? Because now it looks like they're carrying the brunt of the problem because they're not opening the government.
Yeah, I think the political dynamics at play here are fascinating. For Democrats, they're arguing, listen, we just don't trust Republicans at this point. They're very distrustful of them, especially after the changes that were made to Medicaid earlier this year. So they kind of see this shutdown as their only leverage in negotiating over these subsidies and bringing them to the public's attention. I think there was also a timing element here in that they knew that people would be getting notices saying that their health insurance rates are going to be rising for next year. So they saw it as an opportunity to really put this out into the world and have a big discussion about it. On the Republican, go ahead.
No, I was listening to you. Please continue.
Yeah, on the Republican side, though, I think it's very fascinating. Republicans are dug in because they've never voted for Obamacare. They do not support the plan. They've long opposed it. They did not vote to extend these subsidies. So they're viewing it as, why would I vote to help a plan that I don't support in the first place? However, you're seeing a lot of Republicans raise concerns over not extending these subsidies and how it might impact their constituents. Because in fact, a majority of people who use the marketplace coverage live in states that backed President Trump last year in the election.
That is absolutely fascinating when we actually break down kind of the politics and how it works. But, something else that you mentioned was a ticking clock. And something that I'm seeing recurring is a lot of dates and trying to understand what exactly happens when we hit certain times and dates. Can you walk us through that, Amanda, and why that is so important to understand all the different strategies at play in regards that go around these dates?
Absolutely. It's very confusing. So open enrollment begins for most of the country on November 1st. People in Texas will be accessing healthcare.gov, where they can sign up for plans starting November 1st. The subsidies that we're talking about that have made that insurance coverage more affordable over the last couple of years, those expire on December 31st. So they will no longer be applicable for next year's coverage. However, you're seeing insurers, people who run state-based marketplaces, they're saying, listen, we need to know if these subsidies are going to exist or not, probably around the December 15th mark, so we can potentially close down open enrollment, update the website to reflect those new prices. That's kind of the drop-dead deadline that has been floated out there more recently, that mid-December, after that, it's going to be very difficult to make these changes. There's going to be a lot of upheaval if we go past that for next year's coverage.
We're speaking with Amanda Seitz, health reporter at KFF, about the uncertainty surrounding the Affordable Care Act. If you'd like to join the conversation, call or text 713-440-8870. You talked about a little bit ago how the Republicans have never been in favor of the ACA. And we see this clip all the time, President Trump saying in 2 weeks I'll have a plan, in 2 weeks I'll release a plan that's been going on for years. Is there a Republican health care plan out there yet?
Well, Republicans have certainly claimed that they have a plan, but you're right that we have not seen a solid plan that would actually replace Obamacare. And I think that's part of why you're seeing such uncertainty, is that you have some Republicans out there saying, we need to go back to repeal and replace. You have others that are saying, listen, we really do need to extend these subsidies because we have constituents who benefit from this, and we might be hurting next year if we don't. So there's not a very strong consensus among Republicans on how to handle this issue of Obamacare.
And what we understand, people living in most states still use healthcare.gov. And you did talk about the effect that this is having from a state perspective. And you talked about people in Texas. What type of pressure is this putting on state-run marketplaces? Are they in, how does that exactly work?
Yeah, so other states that run their own marketplace, I mean, the directors of those marketplaces are really gaming out all options and scenarios right now. They're talking about maybe having to bring people in over Thanksgiving holiday or even, Christmas Eve, depending on how close we cut it here, to have them update the website. They're talking about temporarily closing the marketplace as well so they can make those updates. Unfortunately, we haven't heard much guidance from the federal government, which runs healthcare.gov, on how they're preparing for this. We do know that they brought in some of those furloughed employees to work on launching healthcare.gov for the November 1st open enrollment date. But how they'll respond to any last minute changes, we're still not sure.
Well, we're also seeing a growing number of Democrats who have signaled that they would be willing to support legislation for some carve-outs in regards to SNAP, the Supplemental Nutrition Assistance Program. And so do you think Republicans would be open to that?
To the SNAP benefit?
Yes, exactly. To provide some type of carve-outs or, specific different rules for different programs.
Yeah, I think that they're really far. The two parties are very far apart right now. And we just haven't seen them come together on any sort of agreement. And, I had heard from the beginning that this shutdown could really drag on. And I think that we are still in for a couple more weeks, unfortunately.
Yeah. There was some rumor going around that it will wrap up right before Thanksgiving, that the plan is to feel the pain up until Thanksgiving, but then they'll open it so people can have Thanksgiving and that SNAP benefits will be back and money will be coming back in, and so that this is a waiting game to see how long they can go. I'm curious to talk a little dollars and cents with you here because I've heard all different sorts of things. When this all starts to take effect and change, how much will people actually feel? I've seen some people say it'll be $50 or $75 more to their premiums monthly. And then I've seen others say it'll be 3 times as much, 4 times as much. What do we believe to happen when this changes?
Well, and the reason you're hearing so many different numbers is because it really depends on your own income, your household size. There's a lot of factors that determine what you pay on the marketplace. So that's why it gets really complicated. But overall, we're expecting premiums themselves, on average, insurers are going to raise those 25%. So that's just the price of the plan itself. And then once those subsidies go away as well, we're expecting that consumers will pay double what they paid this year for coverage next year.
And how many people are we talking about roughly that would see these kind of increases?
Yeah, so most the 24 million people who enroll in marketplace coverage, they're benefiting from those subsidies in some way. So we're talking over 90%. So most of the people who are buying through the marketplace are going to be seeing that. And I want to point out something really specific for Texas. You see how big of a benefit that it's had in a state like Texas, which has gained more people than any other state in the country. Those subsidies, when they were introduced in 2021, about 1.2 million people were enrolled in marketplace coverage in Texas. Right now, you're closer to 4 million. So it's really made the coverage more affordable and accessible to folks across the country.
I want to grab a couple calls, but what fascinates me about the numbers here, even when you talk about 4 million in Texas out of 30 million people, it seems like the percentage of people it's actually hitting is relatively small. Or if you look at 24 million across a country of 360 million, it's a small percentage that are actually hit, yet more people are feeling the shutdown of the government. So does that then counteract what they're trying to accomplish by the Democrats when all of a sudden it's like, well, it didn't hurt me. It may have hurt them over there, but it's not hurting my family, and yet you're shutting down the government. Is that at play in the concern, do you think?
I think that's a really great question. I think that something Democrats were counting on is that the issue overall of rising health plan premiums, which pretty much all people are experiencing right now, whether you're on private insurance, whether you're on Medicare, whether you're on the ACA, that would resonate with a lot of folks. But you're correct that we're only talking about a small percentage of Americans.
Yeah. 713-440-8870 is the number if you'd like to join the conversation. Tracy from West Houston is on the line. Tracy, what's on your mind?
Well, can you hear me all right, Ernie?
Absolutely.
Okay. Well, I am in the employee benefits business. I don't do the ACA subsidy plans. It's the Affordable Care Act is just a growing giant of insurance company profits, and maybe insurance agents are benefiting too. But one of the things that disturbs me, as I read, is that the original act would have that you tell them what your income is, and then you get a subsidy based on your income. And then if your income is greater than you stated on your application, they would claw back your taxes, or you would owe money. But apparently that has never been enforced. So people can state, what their income is and have little or no repercussion. I don't know if that's a huge factor, but it is a factor. The other thing is that I don't think the Affordable Care Act is ever going to make anything less expensive. In my opinion, private insurance companies should insure you up to 250 or 300, some number, large number, and then the government could have an umbrella above that that you would pay through taxes or something. So insurance companies would not have to pay $1 million, $2 million for somebody that has cancer. So, it's just observations that it's a beast that will never shrink.
Tracy, thank you for those comments. Amanda, should we be sending Tracy to Washington to figure this all out, or what do you think about what he just said?
Listen, I've spoken to so many people who are going to be paying higher costs, and everyone shares that frustration of, how high can the costs go for these plans? And in some cases, the deductible, the amount that that you have to pay basically before the insurance kicks in, they're just astronomical. So people feel like they're also paying more for these plans, and they're really not getting a lot of great use out of them. And that is certainly a challenge that I've heard from a lot of folks who are looking at their plans for next year.
Talk Good Music on YouTube says, healthcare should be free for all. I would not mind paying more in taxes for that. 713-440-8870. Doug is on the line. Doug, what's on your mind today? Got to turn off your radio, Doug, so you can hear us. There you go. Doug, what's on your mind? Doug, we're going to have to come back to you in a minute.
Amanda Seitz is a health reporter with KFF. Amanda, thank you for joining us today on Hello Houston.
Thanks so much for having me. It was a pleasure.
Thank you.
Coming up on Hello Houston, we are going to have Sean Tajipour in the house, who's going to talk scary movies from classics to new releases. Stay with us as Hello Houston continues.
We know you value Houston Public Media. That's why you're watching right now. So take the next step and become a new member of the station you rely on. Every gift makes a difference. And what matters most right now is supporting the station that brings you the news and information you rely on. It only takes a minute to make a big difference. So join as a new member today at houstonpublicmedia.org/donate or call 800-364-8300.
Houston Public Media, in partnership with Texas Southern University, brings to you The Vibe. R&B, hip-hop, and neo-soul. Music that resonates with all ages. The Vibe on 88.7 HD3 and on the Houston Public Media app.
Support comes from the Houston Ballet, presenting Stanton Welch's The Nutcracker, a holiday tradition. Clara and the Characters, intricate sets, and new discoveries return to the Wortham November 28th to December 28th. Tickets at houstonballet.org.
Now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. Now here's Ernie Manouse and Celeste Diaz-Sherman.
You might not have heard this, but Halloween is tomorrow. We hadn't even mentioned that. If you're planning on staying in this year, there's no better way to make the night fun than with a film. Whether you're leaning toward family-friendly favorites like Hocus Pocus or some full-on horror like Halloween or the Texas Chainsaw Massacre, the options are wide. Joining us to share his top movie picks and to get you ready for your very own Spook Fest is Sean Tajipour, founder and host of Nerdtropolis. Welcome back to Hello Houston.
I'm excited to be back. It's spooky season,
It
finally.
is.
And it feels like it too, right?
It does.
If folks want to add their own to the list or just join the conversation or just bug Sean about his picks of what are scary movies, give us a call or text 713-440-8870. Okay, what should we be watching? I broke it down like family films, films with friends, and films you're going to watch alone in bed at dark.
Interesting. I break down scary movies by gory, funny, or like mystery.
How do you break them down?
I have them broken down by family-friendly Halloween movies, underrated Halloween movies, and new releases and what to watch. That's what I have.
Well, you brought in something that's creeping out Celeste. So
Yes.
Let's talk new releases to start with, because I think this little guy comes from a new release.
That comes from an upcoming but now in theaters release, Guillermo del Toro's Frankenstein. That is the Frankenstein popcorn bucket that they gave us when I went to go
That's
catch it in
a
LA.
popcorn bucket?
I don't know if they're giving it out in theaters, but when I went to go meet with
Oh, they're
Guillermo
not
and
giving
everyone
them
else,
out. You're
Those
paying for them.
maybe, yeah. Yeah, they're paying for that one.
Those are awesome. So you actually met with Guillermo del Toro.
Yeah, Oscar Isaac, Jacob Elordi, Mia Goth, and everyone else caught it at Netflix's To Doom Theater. And even though this is an upcoming Netflix movie, it's in theaters now. You can watch this on the big screen where Frankenstein is made to be seen. I've talked to several people saying they're glad they're watching it in a theater before it hits Netflix because it's on a grand scale. The best Frankenstein film to date.
Interesting.
Really?
Okay, that's a tall order because I went to Ernie's to watch Frankenstein.
Well, Son of Frankenstein.
Son of Frankenstein.
Let's clarify. But best Frankenstein to date. I remember back when I was a wee one, they did a television big event of a Frankenstein, which was supposed to be much more faithful to the original novel by Mary Shelley. How does this one rank up? Where does it fit into this whole world of it? Is it the real complete story? Is it still, what do you take?
It is a passion project from Guillermo. He grew up at 11 years old reading this book and falling in love with it. So he did the book justice, but also added his own touch to it and really delivered something on the grandest scale. There's a human side to the story, and that's what we really see. It's not technically a horror film, but there's a lot to it and a lot to learn about it. But it definitely will put you in a spooky season. There's a lot of gore, a lot of body parts.
Yeah, gore, body parts.
But a lot of beauty, I will say.
So my question then becomes, when you're talking about the humanity or like the human part of it, right? How much of it did they use? And I just now ask myself immediately when I'm watching any movie, was there CGI? What play did they use technology-wise?
So much practical effects. Guillermo hates CGI when you don't. He doesn't like AI. There's a quote he says about AI that I can't repeat on air, but he does not like it. Everything is as practical as you can do. Maybe some CG techniques just for certain things, but everything is built out. It's beautiful. It's amazing.
See,
and
that's where I think it captures an audience when it's the
you know where I think. How sexy is the monster?
The best looking creature we've seen. It's Jacob Elordi, I have to say.
Yeah, well, he's really tall naturally. I mean, he kind of fits that.
Yeah.
Yeah.
Okay, so we've talked Frankenstein. I want to go back to we've been talking a lot about them because I've become obsessed with them here on the show, the Universal classic monster movies. Do they hold up? Should families be watching those? The old 30s
Classics.
and 40s? Yeah.
I think so. I mean, to get generations to get together and see where really Hollywood started with these types of films and the Universal monsters, which are now making a resurgence because of Universal Epic, the theme park that they're doing. Now they have a whole Universal monster section, and they bring back Frankenstein or the Frankenstein creature, the mummy, and everything else, and kind of bring you back into that world. So it's good to know. It's kind of know your movie history. Go back to the basics.
All right, give us your list. What you got for us?
So for family-friendly Halloween movies, I have Hocus Pocus.
Of course.
Oh, why does that movie, the first one, it just is great. Like the nostalgia of it, but it's old, but it's not that old.
It's not a great cast, great singing, a talking book, right? This is the steelbook version, but this is like not talking book, but the book that's alive. I love that, the spell book. There's just so much magic to that.
Yes, there's a lot of magic, but there's also that level of kind of realness to it. Like it feels real. Like you can picture these characters actually living in a small town in Boston or wherever they live in.
Salem.
Salem.
Okay, that's a pretty obvious one. Give us one that's not so obvious that's family friendly.
Oh, I gotta go with Paranorman and Monster House.
Paranorman, yes.
Paranorman's pretty great, yeah.
Steve Buscemi in Monster House.
Yes, great.
Yeah.
And I love Coraline. That's another favorite of mine.
Dakota Fanning voice.
Yeah.
I just happen to have a cheat sheet in front of me. That's how I catch some of these so
Yeah, but
quickly.
Ernie is a movie buff.
I do
You
enjoy
do,
them.
yes.
I'm more of like the 80s horror films. So we're talking the Friday the 13th, the Halloween.
Maybe
even
some
the
Lost
Halloween
Boys,
78.
maybe
the Lost Boys.
Fright Night.
From Fright Night. Not so much Nightmare on Elm Street. I never really got into the Nightmare on Elm Street.
Ooh, okay. Casper and Hocus Pocus. Is Casper on your list?
Yeah, Casper's on my list.
Sorry, that was from
That's
Charlie
back to
Parker.
family.
Yeah,
it's
But
back to
technically,
family.
so like one I don't really talk much about Halloween is A Nightmare for Christmas because I think it's technically a Christmas movie, I will say, having this one here. But I think you can watch it both holidays. It's the one you can do both.
So you get two
Yeah, both. But
viewings out
I
of
still prefer this over Christmas time, honestly.
Okay, so from the 80s slasher rebirth of horror, what do you like?
Well, I really like Halloween 3, Season of the Witch.
Oh my!
It
you
is
have to
such
leave
an
the studio right now.
I had to mention that. It's Season of the Witch is so underrated. If you just take away the Halloween, like Michael Myers stuff out of it, for what it is, it's really fun.
As
Halloween
a
Mask.
standalone
Yes.
film, I'll give you that. I just don't like snakes, and there's too
Now,
many snakes in it.
This summer, Ernie, weren't you watching all of the different Halloweens?
I did. I watched the whole Halloween during the summer too, because
Summer.
that's for me.
That's the key word.
The different paths they take, the different storylines, the different lines you can do, but they all start with the original '78 Halloween, and then you can go up to the new one, the Blumhouse. You can do the Thorn trilogy.
There's
or
enough
whatever.
of them,
Yeah.
that's for sure.
It's crazy. Okay, modern horror.
Modern horror. Well, actually, I have to, shout out a couple things that you can watch now, actually, that's kind of modern horror. Is It, Welcome to Derry. It's a series on HBO Max. It's a prequel to the It book and series.
I watched part of the first episode through the birth of the baby in the car.
That was enough for you?
I was like, what is this? So what is It, Welcome to Derry? Is it a prequel that was written by Stephen King? Is it imagined from characters? Does it have a through line that's going somewhere?
Yeah, we have it's like the original tale of Pennywise and explores the origin of this Derry's
But
evil.
does it come from Stephen King, or is it they just...
That's a good question. I'll be honest. I've never read the book. I remember watching the 90s like two-parter and watching this one. So if anyone out there can tell us that, I would love to know how much of Stephen King...
713-440-8870. Call and tell us. Inform us.
On that one, because I'm the movie guy, not the book guy.
Okay, so Welcome to Derry, but you like it. You like the It series.
I always liked it. Very creepy, of course. Black Phone 2 came out at theaters, and that's a good follow-up. And it gets
I
Freddy
didn't
Krueger
see
vibes.
Black Phone 1, but just the trailer of Black Phone 2, no thank you.
Ooh, okay. Poltergeist is a classic that doesn't get much attention these days. That's Colby from Katie.
Yes.
That was a movie that I saw when I was a little girl.
A movie Celeste
by
saw?
accident.
that's why
Did
you
not realize what it was. It scared the living daylights out of me. I think it traumatized me so much that's why I'm not I don't like scary anything because of that movie.
Hidden gem nobody would think of. You want us all to think about this Halloween.
Killer Clowns from Outer Space.
Oh my God.
Oh my gosh. Really?
That is such a great film. It's a perfect film for that type of genre, and it's just fun.
If I was a betting man, I would have never won that bet that you would have said Killer Clowns. That's funny.
And they brought back the props to buy. I'm like buying all the little popcorn gun and all the other stuff you can get. It's just such a fun, colorful film. It's just out of nowhere. And yeah, I have to put that there. Another hidden gem is Trick or Treat. Trick or Treat. Trick or Treat, which is great. It's like a three-parter, kind of different stories that interline with each other.
So I'm getting the feeling you're back in the 90s, 80s, and 90s horror films you like a little bit. Scream 7, what can you tell us?
Well, a trailer just dropped today. Nev Campbell back with Courtney Cox, and it's really focused on Sydney's story, and the original creator and director is back on that.
So
I didn't watch the whole trailer because I didn't want to get spoiled.
True, but you have high hopes for it.
I do have high hopes for it. Scream is a classic. It's weird. We're saying Scream is a classic. That came out in the 90s.
Wow,
we got to scream now because we're out of time with you.
Sean Tajipour is the founder and host of Nerdtropolis. Sean, it is always so much fun to have you back in Hello Houston. Thanks for joining us.
Thank you.
Coming up, we'll continue diving into today's top stories. Stay with us for the second hour of Hello Houston.
Stay tuned. There's more Hello Houston on the way with Ernie Manouse, Celeste Diaz-Sherman, and Frank Billingsley. For the latest in local news, subscribe to the Hello Houston daily newsletter at houstonpublicmedia.org. Hello Houston is a production of Houston Public Media. The opinions expressed by the guests of this program are solely their own and do not represent the views of management, staff, or underwriters of Houston Public Media. This is News 88.7.
Support for Houston Public Media comes from listeners like you and from Baylor College of Medicine. Through research and innovation, Baylor continues to redefine what's possible in healthcare and medical discovery.
64 degrees at the University of Houston. I'm Tiffany Taylor. Sunny skies for our Thursday with a high in the upper 60s, looking at an overnight low of 51. This is your NPR station, KUHF Houston News 88.7, a service of the University of Houston. It's 12 o'clock.
Just ahead on this hour of Hello Houston, Houstonians were stuck in traffic for 77 hours on average in 2024. That's according to data from the Texas A&M Transportation Institute. We'll discuss this and more as we continue diving into today's top stories. I'm Celeste Diaz-Sherman.
And I'm Ernie Manouse. We'll also hear the latest installment of InnerVIEWS with scientist, pediatrician, and advocate for global health, Dr. Peter Hotez.
Plus, a rundown of the things currently taking over all of our free time for our regular Thursday feature, Current Obsessions.
And we want to hear yours. Give us a call or text 713-440-8870 or email us at talk@hellohouston.org. You know, you can also watch us on YouTube. Just go to houstonpublicmedia.org.
Hello Houston continues right after the news from NPR and News 88.7.
Hello Houston is made possible in part by founding sponsors John Bradshaw and Kathy Sanders, and by gifts from listeners like you.
Live from NPR News, I'm Lakshmi Singh. President Trump is on his way back to Washington, D.C. after a high-stakes meeting with Chinese leader Xi Jinping. The president spoke with reporters afterward and said he rated the meeting with Xi a 12 out of 10. Here's NPR's Deepa Shivaram.
Trump says he and Xi came to an agreement on a trade deal, but it hasn't been finalized just yet.
It was an outstanding group of decisions, I think, that was made. A lot of decisions were made, too. There wasn't too much left out there.
The U.S. will lower tariffs on China from 57% to 47% because of Xi's commitment to reduce the flow of fentanyl, Trump says. China will also start repurchasing soybeans from the U.S. and stop the recent limit on rare earths exports that was announced a few weeks ago. Trump says he will visit China next April, and Xi will come to the U.S. after that. Deepa Shivaram, NPR News, Gyeongju, Korea.
Hurricane Melissa is approaching Bermuda as a Category 2 hurricane after tearing through Hispaniola, Jamaica, Cuba, and the Bahamas. As one of the region's most powerful storms in the past 100 years, the storm has claimed at least 30 lives. Tens of thousands of people have been displaced. A majority of the fatalities are reported in Haiti. NPR's Rebecca Hersher reports that according to a rapid scientific analysis, climate change made such a disaster about 4 times more likely.
Scientists at Imperial College in the United Kingdom study the role of climate change in individual weather events, like heat waves and hurricanes. To study Hurricane Melissa, they used computer models to compare what actually happened to what would have happened if the planet was the temperature it used to be back in the 1950s. Their findings indicate climate change made it 4 times more likely a Category 5 storm would make landfall in Jamaica. In other words, this disaster would have been much less likely without global warming. Rebecca Hersher, NPR News.
A Senate confirmation hearing on President Trump's nominee for Surgeon General is on hold. NPR's Will Stone reports Dr. Casey Means is having a baby.
The Senate hearing was delayed because Casey Means went into labor.
The hearing was already scheduled to happen virtually, so she didn't have to travel so late in her pregnancy. Means is currently in Hawaii. It's not clear now when the hearing will be rescheduled. Means is an ally of Health Secretary Robert F. Kennedy Jr., but many in public health and medicine argue she's not qualified for the job. While she did go to Stanford Medical School, she never completed her training to become a surgeon. She gained popularity over the past year after publishing a book on diet and metabolic health and going on prominent podcasts, and her brother has been a close advisor to Secretary Kennedy. Will Stone, NPR News.
This is NPR News.
Live from News 88.7 in Houston, I'm Tom Perumian. A man convicted of killing his parents back in 2016 and is currently serving a life sentence in South Texas is appealing his conviction, which came after a third trial. A.J. Armstrong's legal team is attempting to prove that he deserves to have a fourth trial. The 25-year-old was convicted of murdering his parents when he was 16 years old. The basis of the appeal is over accusations of errors in blood splatter evidence submitted on behalf of the state. It's unclear at this time when a decision will be made. The Houston City Council Wednesday approved a major part of Mayor John Whitmire's plan to functionally end street homelessness before 2027. In a 14-1 vote, the council approved a $16 million purchase of a facility in East Downtown that will house hundreds of homeless people at a time. News 88.7's Dominic Anthony Walsh reports.
The plan faced fierce pushback from some residents in the area who raised concerns about public safety and quality of life issues. Whitmire promises increased police patrols and says the facility will reduce visible homelessness across the area. Slated to open early next year, Whitmire says the center is the first of multiple service facilities the administration plans to open across the city.
We're looking at other locations, superb opportunities to really remove the homeless from the streets of Houston.
Officials say it will serve over 1,000 people per year. It's a major part of the push to get everyone into housing within 90 days of them falling into homelessness. I'm Dominic Anthony Walsh, News 88.7.
Taking a check of weather, it's going to be sunny, 71 degrees today with breezy winds up to 10 miles an hour. Tonight, mostly clear with lows dropping into the upper 50s. Right now, mostly clear, 64 degrees on the UH campus. I'm Tom Perumian, News 88.7.
Support for NPR comes from NPR stations. Other contributors include Progressive Insurance with its Name Your Price tool, a way to see coverage options based on a driver's budget. Learn more at progressive.com or 1-800-PROGRESSIVE. Price and coverage match limited by state law.
From Houston Public Media and News 88.7, it's Hello Houston, an open forum on today's biggest stories affecting Houston and beyond. Call now, 713-440-8870, or let us know your thoughts on today's topics by emailing us at talk@hellohouston.org. And now, Hello Houston with Ernie Manouse, Celestia Sherman, and Frank Billingsley.
Hello again.
Hello. It is Thursday, October 30th, one day away from Halloween, and the weather is absolutely stunning outside.
We have been having a lot of fun today and very busy today and learning a lot today. We started off the hour talking about donuts and who makes your favorite donut, because we've been searching for donuts here in the building and nobody has any donuts for us. It's very sad. But to help bridge that gap, we've been asking you about it. Coming up in the show, we're going to be doing our current obsessions, and donuts has obviously become my current obsession. So a little later on the show, start sending in who makes your favorite donut, what donut do you love, if you want to join the chit-chat. We've gotten a whole bunch of responses, and we'll share some of those with you in a little bit. 713-440-8870. Share those with us. Then at the end of the last hour, we were talking horror films, and Celeste suddenly has got a font of information when it comes to movies.
No, I was just saying how I don't watch a ton of movies, but whenever whatever I do, I try to make them be good, right? And and I think my British computer guy asked, Celeste, what's your favorite? So one of the last scary movies that I saw was Let the Right One In. And it is, it's a 2008 Swedish romantic horror film. It was directed by Thomas Alfredson and written by Jean-Afige Lindqvist. I think, I don't know. He wrote the novel. It is Swedish, so that is why I could not say that name. But it is so beautifully written, but also so eerie.
Yeah.
It is smart. I felt like it was smart, and that's what makes things really scary, if that makes sense. I don't know. But it's a great film. I highly recommend it. It's called Let the Right One In.
We had a lot of comments coming in also from YouTube. Remember, you can always watch us on YouTube. On the YouTube channel, you can just look for Hello Houston, and it'll lead you there. If not, just go to HoustonPublicMedia.org or HelloHouston.org, and it's streaming live right there. Easy to find us. We had comments. Monster House used to scare the crap out of me as a kid. Yeah,
Monster
I'm right
House.
there with you when you're a kid.
Never saw it.
Somebody else says, I'm with you, Ernie, 80s all day. And I'm hoping this is a second thought. My 13-year-old daughter loves the movie Coraline, which... Coraline, I mean. But I'm stuck on the 80s. Yes, I love the 80s horror films, that kind of rebirth. And yeah, I know it started in the 70s and, Terror Train and Halloween and all that. But by the 80s, they had kind of got into this new slasher film. But they were different than the horror films that then came out in the 90s and 2000s. They got really brutal, and I just don't enjoy.
Do you think there's a parallel between also the music in the 80s was kind of going there with the glam and the big? It kind of just all evolved.
It was the beginning. The beginning of the 80s was definitely a decade of excess, and it was going back into all this stuff. But also they talk about the economy, and the economy leads to horror films. And so when things around us are uncertain, there's a resurgence in horror. And you can see that even back to the 1930s with the original classic Universal films, and then again in the 80s. And then more recently, we've seen some, especially out of the pandemic that we went through.
Oh.
But anyway, somebody else says, and I keep not saying names because I'm not sure if everyone wants their name read, but they come up on the YouTube channel. We'll just say Brad. A great family-friendly Halloween mini-series is Over the Garden Wall. It's 10-minute episodes, so even you, Celeste, could stay with it. So it's easy to watch in one sitting. Plus, it's a great story.
It's interesting that you mention pandemic, because for me, I've always... pandemic, kind of those outbreaky movies where you have an outbreak type movie. I've always just not liked those. And then after the pandemic, do you remember literally Outbreak
really don't like
from
them.
the 90s, 1995, Outbreak, and then there was Contagion. They freak me out. I just don't I can't. It's just all, I guess that's the point.
Yeah, that's what they're there for.
But after COVID, it really freaked me out.
Deadly Friend was a good Halloween movie from the 80s. I watched Carrie the other night. I haven't seen Carrie in a gazillion years. That's from Toxic Talk Good Music. And also, anyone see Haunting of Hill House? The original with Vincent Price, I think that was the original one, or the more recent remakes that we saw on Netflix.
I believe I saw, I think I might have seen one of those. Yeah.
Somebody said my comment about how during troubled times. So my British computer guy says, so we can expect a bunch of horror coming out over the next 3 years. Yeah, unfortunately, I think so.
Diana Van Neck, 2366, says Carnegie Vanguard High School Theater Department performed Let the Right One In 2019. Truly scary and beautiful.
Oh,
that's right. Oh, Charlie Parker, Texas, is talking about donuts. Apple cider donuts are great. We found them on our trip to Vermont. I'm at Vermont in the fall a few years ago, and now we order them from a company called Wild Grain.
That's awesome. So bring one by here for us. Well, actually, two, because Celeste and I each want our own donut, as long as you're getting them.
We don't want to share that.
Right. We don't want to share a donut. We share a lot here, but that donut we're holding on to. It's interesting you talk about apple cider because I grew up in upstate New York, and often people think New York, Manhattan, New York City. No, it's much more like Vermont and Connecticut where we grew up. And the Cider Mill Playhouse, and they had a cider mill and a theater there, but you would go out there and they had apple cider donuts and you would get the apple cider, and this was the time of the year for that. So thank you, Charlie Parker, Texas, for that memory of apple cider flavoring.
Yes.
Anyway, so there's a lot of that. We'll talk about more in our current obsession. So keep the comments and the thoughts coming in. We'll get to those in just a little bit. But right now, as we have to, we're getting into the headlines. Celeste, take it away.
Thank you, Ernie. Houston drivers spent more time stuck in traffic in 2024 than ever before, or at least since Texas A&M began tracking data in 1982.
I'm already horrified by this story and where it's going.
This is a scary one. Houston commuters were stuck in traffic for a total of 77 hours on average in 2024. 77 hours on average. That's higher than the previous record of 76 hours set in 2018 and recorded again in 2019. The number dropped to 49 hours in 2020 and has been on the rise ever since. American drivers on average spend a record 63 hours annually stuck in traffic. Congestion is once again growing in many cities after a pandemic-era dip, while driver behavior has also changed. This is from the Texas A&M Transportation Institute's 2025 Urban Mobility Report. Traditional rush hours are returning, but there's also a noticeable rise in midday congestion, the report finds, possibly tied to remote and hybrid work changing people's travel behaviors. The researchers use data from the Federal Highway Administration and INREX, a transportation analytics firm. What do you think about Houston traffic and what can be done to fix it? Now is the time to join us on Hello Houston. You can give us a call or send us a text, 713-440-8870.
I've got to say, nobody in Houston has an opinion on traffic. I'm sure no one's going to call. Yeah. Here's your chance to let us hear what you think. Traffic always gets a good response out there. Did you wait? Did you feel like you spent 77 hours? Your British computer guy says 77. I spent that much time in traffic every month. You got to find better routes. Yeah. Sitting in your car can be, I'm of the idea now when I drive, I try and avoid driving during rush hour if I can. And I'm of the mindset, just relax. You know, we're all in this together. We'll get through it. Don't panic or get mad at anyone because that just leaves
you see,
trouble.
I can think that and have that mindset during rush hour. The noticeable rise in midday congestion is what has shocked me here in Houston, that now it just seems that there is traffic jams where I'm just sitting in traffic all the time. You know, whether I am, on top of it, I'm getting here a little bit early to work, or whether I'm running late, it just feels like I'm always in traffic in here in Houston, especially on the weekend as well.
I remember being with Bob Lanier, the old mayor of Houston, and we were sitting around talking about traffic because what had happened is there had been a shutdown of a bunch of services. I can't remember the whole details of it all. And then all of a sudden those were lifted, so construction started again. And there was construction all over the place. This is maybe 20, 25 years ago. And he was saying, when he was mayor, they made sure if one route was closed, the next routes nearby always had to remain open until the work was done in one, regardless of if it was electrical work, if it was sewage work, if it was TxDOT work. He would not allow them all to happen at once. I feel like right now it's a bit of a free-for-all out there. And what you think, okay, this road's closed, I can go, oh, that one's closed too, oh, that one's closed too, oh, they're tearing up here. There's a lot going on. And part of it, too, I think that we're suffering from right now is the World Cup's coming. We remember this every time a Super Bowl is coming. They want to get the city in shape for the influx of traffic next year, so they're doing a lot of stuff to rip it up.
But again, 713-440-8870. You can join the conversation. And Chris from Cypress is on the line. Chris, welcome to Hello Houston.
Hi, thank you for taking my call. I basically live in my car, so I take full advantage. I catch up on all my audiobooks. I catch up on the news, podcasts. It's a necessary evil, but you definitely, you got to make some lemons out of there.
Chris, if you spend all that time in your car, do you find that Zen moment Celeste and I were talking about where you just have to accept the surroundings that you are in and just get through it?
Absolutely. And, the most important thing at the end of the day is just getting home safe. Sometimes a little bit of patience and, letting somebody, proceed and get in front.
Yes.
We're going to, we're all you're all in the same boat, and, we just want to get there to our loved ones home and get there safe. That's
Chris,
the most important thing.
One last question. What audiobook are you listening to?
Right now I'm working on Lee Child's. I'm going through all of the Jack Reacher novels. I think there's like 28 of them, so I've got like 15 hours of listening time. So I'll probably finish that in a week.
If you can find it and you're in the mood for something really lighthearted from many years ago, How to Be Happy Like Me. One of the funniest books I've ever listened to, and I used to listen to it. It's a short listen, and I used to listen to it every time I drove to New Orleans and every time I drove back, and I laughed the whole time. How to Be Happy Like Me.
Thanks, Chris, for calling.
That's on the list.
Okay, thanks. The other thing in your story that you read that I thought was very interesting. Also, people that want to call and tell us their traffic story, 713-440-8870. You were talking about drivers' behavior and discipline out there on the road. I have a friend, I will not give names, who will not use their blinker because they think that's conceding to the people around them what they're about to do. And if other drivers see the blinker on that they're going to turn, they'll block you from turning. So you just got to get into the pockets where you can. I don't get it. I get so frustrated with that. I'm like, put your blinker on. They'll let you in. No, they won't. They're gonna block me. So it's combative out there sometimes.
Yeah, I feel like whenever I'm in a good mood, I'm like, sure, go ahead. Yes, I'll let people get in. They have their blinker on, whether or not. It feels great, right? But if I'm not, it's like, you better get out of my way.
I talk a better game than I drive, I should say. I sound much more. Oh, we got a poll up on our YouTube. What do you think is the biggest cause of Houston traffic? Go to our YouTube right now and you can decide. Is it construction? Is it too many cars? Is it bad behavior? Is it poor city planning? Vote. We'll let you know what everyone thinks at in the end of the segment or maybe the end of the hour. But go over there. Over on our YouTube channel, just look for Hello Houston and it's right there in the chat segment. So share with us what you think. Okay, you ready for something else?
Yes.
This is an interesting story, as I hope they all are on the station here. Texas Attorney General Ken Paxton has filed a lawsuit against Johnson & Johnson and Kenvue, accusing them of failing to warn pregnant women that the pain reliever Tylenol, acetaminophen, may carry risks, including for autism and ADHD in the patient's unborn children, or the people that use it, unborn children. Paxton complaint alleges that the company's aggressively marketed Tylenol as safe for expectant mothers, while they internally knew of evidence suggesting otherwise. The lawsuit claims that J&J tried to dodge liability by shifting Tylenol-related obligations to Kenvue. In response, Kenvue called the claims baseless, defending acetaminophen as the safest available option for pain during pregnancy and pledging to contest this case. The move puts the first state legal salvo into new territory, tying public health, science, and corporate accountability in a high-stakes legal framework. Give us your thoughts. I'm just jumping in with my opinion. 713-440-8870. Is this a real lawsuit or just a waste of time?
I think that as somebody who works in news, we see the amount of lawsuits that are attorney general issues. And so I want to say that it's on the one hand, I appreciate him wanting to be on top of it and trying to bring awareness to something that potentially could be harmful to pregnant women. However, I don't think this is the way to go about it.
I would say I agree with you in that regard. I also think the key point here is that Johnson & Johnson, they internally knew of evidence suggesting that this was harmful. In all the reports we have seen so far, even from RFK Jr., there is no data that says that, A, that is an accurate claim, and secondarily then that anyone within these companies knew it was a problem. If there is evidence that suggests that, this will be groundbreaking. This will be massive. This would be along the lines, I think, of the tobacco industry when it was sued for knowing about carcinogens in cigarettes. So I think there's a lot there if, in fact, it's true. My gut feels this is a political play with a very contested election coming up next year that Ken Paxton is going to be part of, that this realigns him with the whole Trump concept of how we want to look at autism and Tylenol. And so that puts him at the forefront of that so he can say, look, I'm fighting the fight for the people. But please prove me wrong. Show us this evidence that says Johnson & Johnson knew that Tylenol did cause autism and affected ADHD. I would love to see those reports.
And again, what are your thoughts on this lawsuit? Worth it or waste of time? I'm just going to go out there and say waste of time. Moving right
said
along.
all that. Celeste is just going to sum it all up for us.
Waste of time. Okay, what else do we have going on, Ernie?
We got a whole lot more comments on folks when it comes to driving.
Traffic.
Let's grab a couple phone calls. 713-440-8870. I do believe that, who's first? I think Seth is on the line. Seth, what's on your mind? He's calling from the Heights.
Hey, guys. Thanks for taking my call. I think y'all were actually talking about state leadership. I think in terms of transportation, overall, we kind of need a top-down change. We need technocrats who understand the complexity of transportation engineering. I mean, the number of hours in traffic you guys talked about has such a huge economic impact, right? And we can look at the numbers and realize we could actually benefit from a shakeup, such as intercity high-speed rail, intra-city subsurface metro, and an updated set of driving rules where, we make it a little bit more difficult to get a driver's license, maybe because we need better rules that make the highways more efficient. So, an overall sort of different approach to how we do transportation engineering in the state. Thanks.
Seth, please, why are you being so logical and giving us solutions? We just want to hear people complain about traffic. I truly appreciate your thoughtfulness on that topic, and I think we need more people to think it through a little bit more. But thank you for sharing that with us.
100%. Yes.
We got a ton of texts. You want to dig through them for me, Celeste?
Yes. Let's see here. My British computer guy, poor drivers, folks not using turn signals causes accidents.
Thank you for that. I hope my friend is listening.
Charlie Parker Texas, too many people on their phones. Traffic would be so much better if people would put those phones down. I totally agree.
Yeah. Whenever there's really bad traffic, Walt always says to me, it's somebody picking out their favorite Bonnie Tyler song. Because whenever I'm driving, I'm always looking up things on my music to play in the car. And he just makes fun of Bonnie Tyler.
That's why you have a Spotify list.
I know, but my moods change very quickly.
I understand. Oh, trust me, I know. That Tiffany Taylor says, my husband has threatened to disconnect my horn because there are too many people with awful road rage on the roads. And it's not safe to even honk at anyone anymore. Yes, be safe out there. Do not honk.
Takes me back to my idea. Happy horn. A little
happy horn.
Beep, 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 beep. Don't be so mad with your horn.
Ing Elm 5786 says, why isn't there monorail from all directions into the city with some hubs along universities, medical centers, economic centers? Would save so much space on the roads.
My reaction to that is, you're right. Why isn't there better public transportation? We need to get there.
Yes. And one last text. I used to have many secret shortcuts throughout Houston, but then GPS apps came along and ruined it for everyone by making those shortcuts not so secret anymore.
Very true. How many of you do use those navigations, and how often do you think they're right and accurate? I think it's funny. I think back to key maps. Do you remember key maps? You had to get the map of the city, and you always wanted the key map so you knew the best routes, all that stuff. And if you think being on your phone was causing distraction, try opening and unfolding a road map and figure out
I think you probably
going.
had key maps. I had Quest maps where you would put it in your
so you had technology.
Your computer, and then you would print it out.
Oh, like MapQuest?
Was it MapQuest?
MapQuest.
Yeah, okay. I said Quest maps. Okay, my dyslexia, but MapQuest, and then my millennial here I go in the 90s. Then we had our CD books, and we would look through our CD books
to play your music?
To play your CDs, to change out your CDs.
We would stop at the gas stations and get the road maps, those big unfolding that never folded up correctly again to go back. This was my dad would do it. I wasn't doing it, into the glove compartments. Okay, we've got a quick question if we can squeeze them in real fast. This is Brandon from North Houston. Brandon, what's your quick question?
All right, it is a quick question for maybe one of the callers. I'm from West Virginia. Driving is different here. I've been here for 10 years, but why do people not stop at the stoplight when it's a red light? There's like a gap of 2 or 3 cars, difference between the car behind them or the stoplight. And I used to be a truck driver, so when you're downshifting because you think the car in front of you is going to stop at the stoplight, they stop like 2 or 3 or 4 cars distance back. You got to slam on the brakes, but I don't know if the people who are driving are doing it. Please just call and explain, why do you not close the gap? Why do you not stop at the stoplight?
Brandon, I've got something that goes along with that. When I first moved here, I was here, I think, 3 days, and I totaled my brand new car I had bought when I moved here because the lights are on the wrong side of the intersection here too. Was my problem. Back out east, all of the lights are on your side of the intersection, and when I was driving through downtown, they're on the other side of the intersection, across the lane. Threw me off. I was driving up to the light, not realizing it was on the wrong side there. Anyway, there you go. There's my story. Thank you, Brandon, for calling in with your question. If somebody calls, we'll share that information with you. I think it was more rhetorical.
Yeah, for sure. But coming up on Hello Houston, you'll hear the latest installment of InnerVIEWS as Ernie talks with Dr. Peter Hotez. This is News 88.7.
Hello, I'm Bob Maniger from the Ed and Jean Matthews Foundation. PBS has been a part of our family for generations, and we are proud supporters of Houston Public Media. From PBS Kids programming that supports children and their parents to PBS NewsHour that we rely on to learn about what's going on in our world. Your support keeps PBS available for our community across Greater Houston. Give now at houstonpublicmedia.org/donate.
I'm Michael Schaefer. My partner Ellen and I have supported public radio and TV for decades.
We count on it every day for trusted news, culture, and great entertainment.
With federal funding eliminated, Houston Public Media faces real challenges. That's why we're giving to the Resiliency Fund.
Let's keep public media thriving by the people and for the people.
Donate now to the Resiliency Fund at houstonpublicmedia.org.
This is Jennifer Hickson of The Moth. Moth shows feature eyewitness accounts of the most important or hilarious or moving stories in a person's life. We don't allow any sort of script on stage, so the stories have the excitement of a sporting event, but the intimacy of a tete-a-tete. The Moth is simple and satisfying, like a home-cooked meal for the ears. That's The Moth Radio Hour from the Public Radio Exchange, prx.org.
The Moth Radio Hour, Saturdays at noon on News 88.7.
Support comes from the Houston Ballet, presenting Stanton Welch's The Nutcracker, a holiday tradition. Clara and the Characters, intricate sets, and new discoveries return to the Wortham November 28th to December 28th. Tickets at houstonballet.org.
Support comes from Austin College, where students engage with a dedicated faculty mentor, experience hands-on learning, and discover their own academic journey. Located in Sherman, Texas, north of Dallas. Learn more at austincollege.edu.
And now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. Now here's Ernie Manouse and Celeste Diaz-Sherman.
Scientist, pediatrician, and advocate for global health, Dr. Peter Hotez, Dean for the National School of Tropical Medicine at Baylor College of Medicine, has spent a great deal of his current career educating people about the science of vaccines and better understanding autism, its causes, and the many fallacies that have sprung up around it. Here now, in an excerpt from my newest episode of the series InnerVIEWS with Ernie Manouse, Dr. Peter Hotez talks about the changing views he has witnessed surrounding vaccines and autism and causes for it, and understanding that more clearly and fully. Does that then take some of the autism today and causes autism today, and causes for it, and understanding that more clearly and fully, does that then take some of the steam out of the vaccines cause autism?
Well, it started to, and after I wrote the book, I think we had taken a lot of the steam out of the autism argument, and it moved on to other things, which we'll talk about. And then our friend Mr. Kennedy became Health and Human Services Secretary, and he's brought it all screaming back. I mean, there's three parts to this. I mean, first is the massive scientific evidence showing that vaccines don't cause autism. And even that has a lot of moving goalposts because the anti-vaccine activists keep switching up what they're alleging. I mean, they originally claimed it was the measles, mumps, rubella vaccine. And when that article was retracted, that was a paper published in The Lancet in 1998, a British medical journal. When that was retracted, it was shown to be a fraudulent paper. But also there were large-scale studies showing that kids who got the MMR vaccine were no more like the measles, mumps, rubella vaccine, were no more likely to acquire autism than kids who didn't. That should have been the end of it, but then Mr. Kennedy wrote an article in that well-respected biomedical journal called Rolling Stone that in 2005 he said it was the thimerosal preservative. It was all BS, right? That was in vaccines. And then it was spacing vaccines too close together and alum in vaccines. And so, we're always kind of playing this catch-up game of whatever you want to call it, whack-a-mole or moving goalposts, dealing with that. But then the other piece to the argument is, I could debunk each of those arguments, but then parents would say, okay, doc, now I get it. Vaccines don't cause autism. Hey, doc, what causes autism?
Right.
Which is a very reasonable thing to ask, right? And the point is we have about 100 genes, all involved in early fetal brain development during pregnancy, associated with the cause of autism. We actually did genomic sequencing on Rachel, and my wife Ann and I here with Baylor Genetics, and we found Rachel's autism gene, which is similar to the others. They're involved in neuronal connections, synaptic connections. Many of them are neuronal cytoskeleton genes, how neurons interact with each other, which makes a heck of a lot more sense than something like vaccines. And so the point is it's happening in early fetal brain development. It doesn't mean, Ernie, that there's no environmental link, but if it's an environmental insult, it's something that's occurring early on in pregnancy, interacting with the autism genes. So let me give you an example. If you're pregnant and not aware of it, and you're on an anti-seizure medication called Depakote, otherwise known as valproic acid, that medication interacts with your autism genes and increases the likelihood your child will be born with an autism phenotype. And, and in the book, and in my discussions with Bobby, I identified about half a dozen chemical exposures that do that. And I remember talking to him about this back in 2017. I said, Bobby, you should be all over this. You're an environmental attorney, right? This is how you got into it, right? It's not mercury, but it's this stuff. And it's not thimerosal. It's happening during pregnancy. Here's the list of 6 or 7 that we know about. Run with it, right? Find others and do some good in the world. And he couldn't care less. He absolutely couldn't care less.
Why?
He was so fixated. He had this fixed belief that, it had to be vaccines. And it turns out he was making his living suing vaccine companies. So
but why did that? Where did that enter into the collective consciousness that it was the vaccines? Do you know how that began?
Why did Andrew Wakefield write that Lancet paper in 1998 alleging it was MMR vaccine? Why did Kennedy then, when MMR was debunked, why did he then have to find another aspect of vaccines? What was this obsession to do it? I don't know. Part of it was, making money. They're suing vaccine companies or desperation for relevance, or also very simplistic thinking about autism, not really thinking profoundly or deeply about what autism is and how it does. They used to call it pervasive developmental disorder because it is pervasive. It occurs through autism genes profoundly affecting neuron development. And yet they had this very childlike, simple thinking that the child is fine. Then there's an abrupt event between the first and second year of life, and that must be in some environmental toxin exposure. And that's absolutely not what happens with autism.
So we often think about this and talk about this topic as though how it harms vaccines by this belief system, where listening to you now, I think, but it actually harms better understanding autism, because instead of doing the work we need to be doing there, we are trying to create this other answer, which science isn't supporting.
That's right. And not only is it science not supporting it, we have limited resources, right? And there's just so many things that we can look into. And so by shifting all the focus in order to sue vaccine companies or whatever they're doing, and not doing anything to really help us understand the real causes of autism, and not doing anything to help the families of kids with autism. I mean, what keeps me up at night, what keeps Ann up at night is, Rachel's an adult. She has She's in her 30s. She has a verbal IQ of in the 80 to 90 range, a functional IQ in the 40-plus range. She can't count money. She's very interactive. She's got a great life. She's, has friends. She walks to Goodwill every day. Goodwill's been an amazing organization for her, and she gets a paycheck she's very proud of. And the problem that we face is what happens after we're gone, because she can't live independently and there's no safety net. So that's a big worry, as well as other adults with intellectual and developmental disabilities. And that's what we need help in, not Mr. Kennedy, one, coming up with these crackpot ideas about vaccines, problem number one. Problem number two, and the way he talks about people on the autism spectrum in the darkest terms, right? He says, quote, unquote, to paraphrase, they can't use the toilet, they don't work, they don't contribute to society, they don't pay taxes. My first one is go to hell, Bobby. That's not Rachel, right? She works, she's proud of getting a paycheck, she's proud of paying taxes, she has friends, she goes to the movies, and then he tried to walk it back a little bit, and he says I only meant the 25% of people with autism. I don't even know where he gets the 25%. So, and then he wants to create this registry of people after he talks about vaccines using a lot of Holocaust imagery and that sort of thing. I mean, I don't want my daughter to be on Mr. Kennedy's registry. But again, it sucks all the oxygen out of the room of what parents with kids and adults with intellectual and developmental disabilities really need. So it does damage on multiple fronts. It stigmatizes children and adults with autism. It sucks away resources from things families really need, and it minimizes what people who are needed to help people on the autism spectrum, what we're trying to do.
Ernie in conversation with Dr. Peter Hotez, scientist, pediatrician, and advocate for global health. This full interview is now available on the Houston Public Media YouTube channel. Just look for InnerVIEWS with Ernie Manouse, Dr. Peter Hotez. Coming up, scary movies, current obsessions, Houston traffic, and donuts. We're covering it all. Stay with us as Hello Houston comes right back.
Hi, I'm Michael Schaefer. My partner Ellen and I have been proud supporters of public radio and TV for decades.
We really would be lost without our daily fix of unbiased national and local news, cultural programming, and great entertainment.
But with recent federal defunding, stations like Houston Public Media face real challenges.
Now's the time to step up.
Give now at houstonpublicmedia.org.
Thank you.
Hi, I'm John Donvan, host of Open to Debate, where we bring you open-minded discussions and debates about the issues affecting our lives. Everything from science and tech to politics, culture, and foreign policy. In our divided nation, we feel it's more important than ever for people to be open-minded, open to disagreement, and open to listening to the other side. Join me in being open to debate.
Tune in Sunday night at 10 on News 88.7.
On the next Science Friday, big news in the food allergy world. Peanut allergies in kids are finally on the decline.
This gives us a little bit of hope that we are making a dent in food allergy.
Learn why on Science Friday from WNYC Studios.
Support comes from Houston Habitat for Humanity, working alongside Houston families to build, repair, and finance homes. Together, we build a stronger Houston. Learn more at houstonhabitat.org/NPR. Tonight on Houston Public Media TV 8, a night of mystery and intrigue with Father Brown at 7, followed by the Sister Boniface Mysteries at 8 and Death in Paradise at 9. Tonight on Houston Public Media TV 8.
And now back to Hello Houston. To comment on any of today's topics, call or text 713-440-8870 or email us at talk@hellohouston.org. Now here's Ernie Manouse and Celeste Diaz-Sherman.
Well, a lot going on today's show. That is certainly for sure. This is usually our current obsessions segment, but we seem to have been obsessed with a lot of things today. So we're going to be talking a little bit more about traffic. We're going to talk about donuts. We're going to talk about your favorite horror movies. And we're going to get to our current obsessions, but I want to cap the Peter Hotez interview, what you heard. And for those of you who don't follow regularly, so that's a segment of a much longer interview that we did. Interview series are long format interviews, and they're up on YouTube. And so we talked for maybe about an hour about his life and career and the work he has done and what he's currently doing. So you can go there and hear the entire interview, but that was just a piece of it. We had some feedback from our audience. One person wrote, Dr. Hotez is a hero. Another person wrote, love Dr. Hotez. Thanks for having him on. He has advocated tirelessly for children. They went on to say those in pediatrics know that vaccines save lives, and we see the bad outcomes that come from not vaccinating our children. Thank you, Ernie, for talking with him. It's
Peter interesting Hotez. Because I would say some of our more viewed YouTube segments have been with Dr. Peter Hotez, and the amount of hate that he also gets is...
There is a big contingent out there, the anti-vaxxers, and when they hear that he is on, they will mobilize to slam your feeds, to say all this stuff. And he talks about that. He talks about people's misunderstandings, misconceptions, what's been fed into this, how the science, understanding of the science has changed over the years. It's kind of fascinating.
It is fascinating because you just never thought that somebody like that would become so controversial.
My favorite Peter Hotez fact, I don't even think we mentioned it in this interview. His very first book, who wrote the foreword for it? It was about clean water in the rest of the world.
Who wrote the foreword?
Cher.
Really?
Yes, he knows Cher. This is a man who's got a lot of different...
He knows Cher.
Anyway, so that's there. Another one we were going over, donuts. We were talking lots of donuts earlier today. Mm-hmm. I don't even know how you say that. Gorbos Donuts?
I don't see it. Gorbos Donut in Austin. Absolutely amazing.
Yeah, John suggested us check those out. We had a whole lot of donut ones. They'll compile and send that over to us so we can share those with you. We were talking about traffic, and over on our YouTube channel, we put up a poll, and the question was, what do you think is the biggest cause of Houston traffic? Basically, Houston's bad traffic. The choices were bad drivers, too many cars, poor city planning, or construction. Bad drivers was number one.
I second that.
I
voted. That was
in
my
a
vote.
tie with too many cars and poor city planning, and lastly, construction. But it's you bad drivers. We're blaming you.
That's right, not me.
Listeners. Not you. Celeste is a good driver. You're bad drivers.
Again, 713-440-8870. You can also call in with your current obsession. We were also talking horror flicks and movies and scary, spooky movies. And Ron Clark sent us an email that says Quartermass. That was his scary movie or horror.
I don't know.
Frances Fisher said her scary movie recommendation saw Suspiria at the River Oaks, and it was amazing. Such a visual feast for the eyes. The 1970s version. It was one of the last films filmed in Technicolor. So very interesting. Yeah. You know, one that we haven't said on air today is Texas Chainsaw Massacre.
Last year, they celebrated their 50th anniversary of that film 50 years ago.
Yeah, that's a creepy one.
They made that one. Yeah, and then it led to an entire Texas Chainsaw sequels and requels and prequels and remounts.
Lenny Bean Wilner said People Under the Stairs, 80s sleeper classic. Yes, we got quite a few emails as well. You can always shoot us an email, even when our show isn't on air during the week or, on the weekend. hello@hellohouston.org.
Who can forget when you're talking about horror films? These are the films. Okay, so I said I broke them up into different lists. And this horror film list was watching with adult friends. So get your little group together and watch them.
Adult friends.
The recommendation. Yeah, don't. This isn't for kids. The Shining.
Ooh, yeah, scary.
Remember that
Very
one?
scary. I only saw parts of it. I can't do it. It just freaks me out.
Get Out.
Ooh, that's a more modern one.
A couple years ago. That was 8 years ago already.
Wow, that's a great. Yeah. That's a good one.
That one is creepy. A Quiet Place. They've had a sequel to that too. I couldn't make it through A Quiet Place. Neither could you.
Oh, no.
Two of us were just too noisy.
We're way too nosy.
Hereditary. The Conjuring. Love The Conjuring.
Creepy one.
They're about a real-life pair of paranormal investigators like we had on the show a few days ago. We had just one of a pair that actually do that.
Mm-hmm.
Don't Breathe. And
Don't Breathe. That already gives me anxiety.
I don't even know how to say it. The Babdocks? Babdukes?
I don't know.
Yeah. Those are the ones watch with your friends.
Let's see. My British Computer Eyes. Current Obsession. So we're jumping into our current obsessions. Echo 3, 2022 show on Apple TV about a woman who is kidnapped in Colombia, and her brother and her husband, who are special forces, go in to try to save her. Nikki says, Ernie, are you going to get donuts after the show? Are you?
I'm going to have to. I don't have any donuts here.
Maybe we'll go to lunch, Ernie.
And have donuts?
And have donuts.
Okay, back to a donut for 1 second. You can get back to when they take donuts and do more than just donuts with it. Like when they...
A cereal.
I'm talking about when they use a donut to put like a hamburger in the middle
No,
of
thank
something. I don't buy that. I'm not
thing.
into that thing either.
Yeah.
Yeah.
Well, I know
Okay,
you're not
good.
into chicken and waffles.
I'm not into it because I don't think I've ever really had an experience. It's just the bones.
Okay, we're going to have to change that because there's like a restaurant here
Maybe
in
that's
Houston
where
that's...
we'll go for
No,
lunch.
nothing we can do that.
Okay.
Let's see. Wine Goddess. Ernie, where is streaming audiobook How to Be for Happy
How
Like
to be
Me book?
happy like me. I'm going to look for that.
All I see is an audio
tape.
CD that won't work for rental cars whatsoever.
Yes, and I had it on CD back in the day.
Sean Radigan says Houston does not have the population density required for passenger rail. Nobody goes to Dallas for fun.
Oh, you could. I've been to Dallas for fun. Just
Mr. Uncle Walt, House is my favorite horror movie. Have you seen House, Ernie?
Yes. I actually know who this person is. It's Walt.
Oh.
Don't get fooled by the Uncle Walt. And he always is trying to make us watch House.
That's not the person that doesn't use his blinker, is it?
Oh, I didn't say who is the person
okay.
that doesn't use the
Got
blinker.
it.
But
Got
watching House, that's solely on him.
Solely on him. There we go. Anyway.
I'm looking to see if How to Be Happy Like Me is out and streaming. It's by Meryl Marco, who was David Letterman's partner for many years. She also had a cameo on Hacks this last season.
I love Hacks.
Ernie
got me obsessed with Hacks.
What are you watching right now?
Nothing really. We're kind of in that whole... I've been working on school projects and working on Philip's Halloween costumes, so I haven't really been watching anything lately. If you're okay, I'm going to divert us.
Please.
I am reading a book about Edie Sedgwick.
Edie Sedgwick, yes.
That is my current obsession, Ernie. I am absolutely obsessed with that time period and kind of the psychology of what was happening with people going from the 50s, the very strict social realms of the 50s into the 60s. Yeah, and Andy Warhol.
In college, I got very into the world of Andy Warhol. Really loved it. Read Edie.
Well, you recommended it because I loved that. I'm not going to talk about the very bad movie that I watched.
Yes, but I truly was obsessed with the whole factory era. There's a lot of movies that came out. It's hard to find a really great one about it. But there's a lot that get little bits and pieces of it. There was what was it called? On Netflix, they had done a recreation using Andy Warhol's diaries and then an AI voice of Andy Warhol it was actually Bill Pullman. Bill, what was his name? The comedian, Broadway actor. They used his voice and fed it into it to help create, and they used him as the body of Andy Warhol. It's really, technologically, it was fascinating, but it was about Andy Warhol. And it's a really good story of looking at Andy Warhol and his relationships. You may want to take a look at
Well, that's like basically this book, Edie Sedgwick. I proposed to Ernie last night. I sent Ernie a text and said, next Halloween, I think we have our couple's costume. Andy Warhol and Edie Sedgwick.
Yes, you do think that's what we should be for Halloween. So we'll see. I have to get my silver-haired wig out.
I'm going to have to get my...
Maybe my hair is looking silver-haired already. Maybe I won't need an Andy Warhol wig.
We can wear matching striped shirts with boat necks.
The little sailor outfits that they had.
They had. And I can wear the big hoop earrings. And
TV-wise, what I'm obsessed with right now, and it was because I believe on the show somebody recommended it, and it was Boots. And it is a Netflix series in the top 10 right now. And at first I was like, I don't want to watch this. I don't want to watch it. And it's about this gay kid who goes into the Marines and his experience in the Marines at boot camp. And it's really good, very disturbing.
What's the era?
Late 80s.
Okay.
So it's got a little bit of a nostalgia tinge to it. and the clothing and all that. But it's really, really interesting. What are you watching? What are you sharing with us?
Okay.
713-440-8870. What's on your mind now?
We just got a text. Current obsession, Aggie football. CK from Magnolia. There you go.
Yeah, are they playing
college football?
Does that happen during the Halloween season? Tiffany, our announcer and board op during our show, is over there very excited that was said. Yes, she's waving her hands in the air.
We also got a text about scary movies. This is Lupe in South Houston. Hey, Lupe. They say, scary movies. I saw Child's Play, Chucky, at a sleepover when I was in middle school. I had my buddy doll in my closet from when I was younger. I almost... and Chucky still scares me. So I'm almost 50 and Chucky still scares me. Lupe.
Thank you, Lupe. I have a story about Child's Play. Is that the movie with Chucky? Child's Play?
Yeah.
So the second one, I think it is, in the movie, the doll throws someone out of a window, glass window, and they fall from a townhouse.
Sounds very gruesome.
It was shot in Chicago. I was coming home from work, or maybe from school, and I stopped on the street. A bunch of us stood there and watched, and they did it a few times, and we saw the stunt person fly through the window, and it's sugar glass is what they used to go through, and a piece fell to the street, and I picked it up, and I still have it today in the little like styrofoamy balsam wood frame of it, and the piece of glass from the chute.
Super
I think
cool.
Child's Play 2 is when that happens.
I love that.
There you go. Crash Landing on You. One of many South Korean dramas is an obsession we got texted in about.
Yeah.
Okay, I'm going back to horror films.
Okay,
Unless
to me.
you have somewhere else to take me.
I know. I'm going with you.
If you are going to watch, I've said this before, if you're going to watch Dracula, if I'm talking about the 1931 Bela Lugosi, the real birth of the Universal movie horror films, also try and find the Spanish version of Dracula that was done.
You've
was the
talked about this as your current
kind
obsession.
of fascinating. Yes, it's shot the same time as they shot Dracula. During the day, they would shoot Dracula, and at night, Mexican director, I believe it was Mexican, came in with a Spanish-speaking cast, and they reshot on the same sets that were being used to film Dracula during the day with Bela Lugosi. And so it's very similar, but different nuance. It's very interesting.
That sounds very cool. And Nikki Levy, 19, will you guys be dressing up for the show tomorrow?
I want to. My costume has a mask, and so it makes it hard, but I will be popping it on and off, I think. How about you?
I will not.
Come on, Celeste.
I don't know. I don't-
really dumb.
Last year for work, I just dressed up as my normal self. I dressed up as a witch. Just kidding.
Well, considering the
Just
costume
kidding.
I'm wearing, you could be one of my victims tomorrow if you just come dressed normally. Okay.
I'm gonna be. That's where I'll be.
We got another one said, I am watching YouTube videos of Karens getting arrested. Yeah, I would think one or two of them is enough for me, but there you go.
Gosh.
Don't sleep on A24 movies.
I
when you see any of those A24 movies. That
productions, they're great. That studio always has some amazing, just very interesting kind of artsy films, I feel like. They're known for that. Nikki Levy also asked, says, I just finished Haunting of Hill House on Netflix. It is phenomenal, perfect for spooky season. I'm also reading The Handmaid's Tale. Atwood's writing is so poetic and smart. Ooh, The Handmaid's Tale. Did you watch those?
I watched up until middle of season 3, I think. At one point, I was like, okay, I have had it.
Yeah.
I am looking on Reddit, and they are saying How to Be Happy Like Me is on audio, and I'm trying to find out if it streams. It may only be available as an audiobook, as far as I can tell. But if enough people push for it, I'm sure they can put it up, because they did record it. So there you go.
Let's see here. Slow Horses on Apple TV. So apparently that's another one.
That's people's obsessions. I'm going back to my horror films.
Okay.
You have shown these to your kids. We talked about it. If you've got young kids and you want to introduce them to the Universal monsters, I recommend going through Abbott and Costello.
That was so great. Yes, in the classic.
Great way to get into it for Halloween.
But I am going to pivot a little bit. I know we're talking spooky season, but it's also election season. And so we do have a special election show coming up. Ernie, why don't you tell us about it?
Yes, on election night, 8 o'clock, right here on News 88.7. We'll also be streaming live on YouTube. We are going to be looking at the results we know. We've got special guests. Andrew Schneider will be hosting along with me, and Geronimo Cortina from Party Politics will also be here. we figured that, there's a need on election night in this town. We don't really feast on the results as they come in. We get them in the local news, and that's about it. We know this is a bit quieter of an election, but there are some very important races being decided, and so they'll probably be going to runoffs, but we'll have all the latest updates and news for you. So remember, 8 o'clock right here on November 4th, Election Day. That will be after you have voted that day, if you voted that day, or if you choose to vote right now. Early voting is going on till tomorrow night at 7 p.m. Get out there, vote, know your candidates, know what you're doing. Anyone registered in a county can vote anywhere in that county, so you don't have to find your polling location. Go to the one close to work, and as they say, lines are very low. You can get in and get out. Make sure you check and see what the props are for, too. Sometimes the wording can be very misleading, or they can make it sound so obvious and simple.
Yes, and you can go to harrisvotes.com, and there should be a lot of information there for you as well. And that brings us to the end of our show. We want to thank you for watching, joining us, chatting, calling, texting, emailing. Hello, Houston. We'll be back tomorrow with more conversations. Happy Thursday. Go outside. It's beautiful. This is News 88.7.
Thanks for listening to Hello Houston. Join us every Monday through Friday from 11 a.m. to 1 p.m. to talk all things Houston. The Hello Houston production team includes Garrett Bowman, William Menjivar, Jen Altide, Todd Holslander, and Jim Kovacic. For the latest in local news, subscribe to the Hello Houston daily newsletter at HoustonPublicMedia.org. Hello Houston is a production of Houston Public Media. The opinions expressed by the guests of this program are solely their own and do not represent the views of management, staff, or underwriters of Houston Public Media. This is News 88.7.